Yeah, I would say that don't let your system deteriorate till the end. Means you're obese and you're suffering from lot of these problems like diabetes, cardiac diseases, hypertension, and then you wait till your heart goes absolutely bad or your lungs are absolutely deteriorated, you become wheelchair bound or bed bound and then opt for surgery. Your quality of life doesn't come back to normal. You may lose weight, your sugars may still come under control, but your heart which has gone bad or your lungs which are totally damaged or your joints which are totally gone will never recover. So earlier phases when you are starting to become morbid obese, that is your BMI is going above 30 and then you feel that you are not able to shake off the weight with diet and exercise, then you should opt for bariatric surgery, because surgery will give you weight loss and improve in all the coexisting comorbid diseases and improve the quality of life and prevent your end organs from becoming end damaged.